Heart failure, a relentless condition in which the heart can't pump blood effectively, is as prevalent as it is devastating. It results in symptoms like shortness of breath, fatigue, and fluid retention, but treatment can alleviate symptoms, slow the disease progression, and extend life. Numerous classes of drugs are utilized to manage heart failure, each with its unique mechanisms and benefits. Take angiotensin-converting enzyme inhibitors, or ACE inhibitors, for instance. These include lisinopril, enalapril, and ramipril. Their primary function is to inhibit the conversion of angiotensin 1 to angiotensin II, which results in reduced vasoconstriction and aldosterone release. This leads to vasodilation and decreased fluid retention, improving symptoms, decreasing hospitalizations, and prolonging survival. Angiotensin II. Receptor blockers, or ARBs, such as losartan, valsartan, and candesartan, block the action of angiotensin II on its receptors. Their benefits are similar to ACE inhibitors, providing an alternative for patients intolerant to ACE inhibitors. Beta blockers, including carvedilol, metoprolol, and bisoprolol, block beta-adrenergic receptors, reducing heart rate, blood pressure, and myocardial oxygen demand. They improve symptoms, reduce hospitalizations, and extend survival. Diuretics like furosemide and bumetanide increase urine production, reducing fluid overload and symptoms of congestion. They relieve symptoms of fluid retention but do not alter disease progression. Aldosterone antagonists, such as spironolactone and eplerenone, block the effects of aldosterone, reducing sodium and water retention and fibrosis. They improve symptoms and prolong survival, especially in severe heart failure. Hydralazine and isosorbidadienitrate, or Badil, lead to arterial and venous dilation. They improve symptoms and survival, particularly in African American patients. Digoxin increases myocardial contractility and reduces heart rate through its effects on sodium-potassium ATPase. It improves symptoms but does not reduce mortality and is used in select cases. Sacubitril, valsartan, or Entresto, combines a neprilysin inhibitor with an ARB, leading to vasodilation and decreased sodium retention. It improves symptoms and reduces mortality compared to ACE inhibitors alone. Ivabradine selectively inhibits the IF current in the sinoatrial node, reducing heart rate without affecting contractility or conduction. It reduces hospitalizations for worsening heart failure symptoms in select patients. Lastly, SGLT2 inhibitors, such as empagliflozin and dapagliflozin, inhibit sodium glucose cotransporter 2 in the proximal tubule, leading to glycosuria and natriuresis, reducing blood pressure, weight, and heart failure events. They improve cardiovascular outcomes and slow the progression of heart failure, especially in patients with diabetes. Bear in mind, the use of these drugs should be tailored to the patient's specific condition, comorbidities, and tolerability. Regular monitoring and adjustments are vital to optimize therapy and improve outcomes in heart failure patients.